Hello, today we're going to talk about how we're going to clean up this wound here that Dexter has. Yesterday he got cast in a fence. The silver spray on there is a liquid bandage that we really love to use here. It provides a nice barrier between the horse's wound and the environment for things that we can't wrap very well. As you can see here, it was a pretty big wound that went all the way up here. We did our best to doctor it yesterday, but it did bleed through the night, and he was pretty reactive. He got stuck in an electric fence, believe it or not, and so he was pretty afraid to have us touch him for a while after. But today, now that he's settled down some, we're going to get some warm water, and then I'm going to spray some Vetricyn on it, and then we'll go through our process after that about what I will do later as well. So I like to use warm water because I feel like it helps break up the gunk, and it's a little bit kinder to the horses if you have it. If you don't have it, then you can deal with cold water as well too. But this is going to be decently painful for him, and I'm not going to scrub it because I don't want to risk taking off any scabs that have formed, but I'm just going to kind of try to get it cleaned up here. I'm going to switch to my other hand. And I'm not concerned about the silver spray necessarily coming off. I don't mind if that stays on through this process because I'm actually going to put some more later once everything dries off. The silver spray just doesn't adhere as well when everything's wet. And I like using the Vetricyn versus like Cut Heal or any one of those other products because it stings less and it's still just as effective. Okay, so now we've cleaned off the wound a little bit more, and you can see the spots in here where it's a little bit shallower and then a little bit deeper. So the deeper spots have a tendency, thank gosh for him, to be on the cannon bone and not in the joint here. We would be more worried about these wounds if the deeper ones were near here. But even then, since he's such a good boy, he really lets me get a look in here. And he did the same thing yesterday and see that there's no, I'm going to turn down the water. It's getting too hot. I don't want to burn him. See that there's no puncture wounds in there. If you ever have anything in question near a joint, a puncture or anything deep, please call your vet. Don't hesitate. It can really ruin your horse's career if there gets to be an infection inside of the joint. So now that I'm pretty much finished up here, and I'm going to call it good because these almost look like little scabs, and I don't want to scrub those off. So I'm going to turn off the water here. Then I'm going to get my Vetricyn and make sure that it's turned on and the sprayer works. No sprayer drama, thank gosh. Okay, and I'm going to spray it on there. As you can see, he's not really reacting because this stuff doesn't sting a whole lot. I'm going to see if I can get it over to the spray side. There we go. Get a wider berth on it. So what I'm going to do now that I've got this pretty thoroughly sprayed is I'm going to let it dry. And then I'm going to come back later with one of my favorite products called Alushield and show you how we use that. But I really want this. Hi guys. So now that the wound has dried, we're going to come in and spray it with our Alushield liquid bandage. So I'm going to go ahead and lift the leg up here because he's pretty worried about it. See if I can get him to spray it. There we go. Oh, buddy, we're going to let it rest a little bit. So it's pretty sensitive, as you guys can tell, so we're trying to be very gentle with him. The majority of the wound is down here. So I'm just going to let him rest for a minute. We like using the Alushield because it's a large area to wrap, and this helps protect the wound from any outside bacteria. A lot of our vets really recommend this as well. So I'm just going to try to look over here. Good boy. Let's see if I can get any spot. I know. Easy. Just going to stay with him. until he gets less worried about what I'm doing here. And I think we're going to call that pretty good. The stuff up on top is just a little bit more of a scrape, but that part down there is a little bit deeper. So maybe I'll try to come back later and do some more, but I know this is pretty darn painful for him.